Hey G Mamas, today I would like to talk about first trimester symptoms. The list could go very large. If you go online, you will see that pretty much anything that happened to you in your first trimester and during your pregnancy, really, it's typical and it's normal, and it usually happened to someone, and pretty much all of the four happened to all of the mamas. So here are the four symptoms that I experienced my first trimester. Each pregnancy is different, each person is different, and you always have to consult with your doctor if you are concerned about any particular symptom that you may be having. Yeah, so let's start with morning sickness, because a lot of people say that that's pretty much what happened to everyone. Yeah, so from the very moment that you find out that you're pregnant, and even before, sometimes you find out that you're pregnant because you feel so sick. Bear in mind that it's not only in the morning, although the name is morning sickness. This can happen any time of the day, and doctors say maybe keep eating smaller meals, or maybe take some ginger tea to reduce that feeling. There are also some pregnancy, I believe it's vitamins that you can take to prevent you from getting nauseous and from getting sick. You can talk about those with your doctor if you're feeling really ill. I was really lucky because I haven't had this experience much. I'm not gonna say at all, because I did throw up like 3 times my first trimester, but they were for really random reasons. I don't even know if they have anything to do with the baby. And I think, if I remember well, I think one time was because I woke up and I decided to go really healthy and have this lemon water with lemon, which everyone said is the first thing that you should take in the morning, is a glass of water with squeezed lemon. And I did that, and halfway through the glass I needed to run to the toilet and throw up. So I suppose baby don't like very much lemon. And then the other time was exactly when I was feeling nausea, because I did not throw up a lot, but I did feel nauseous about week 8, 9, to the point of food aversion. I didn't want to eat anything. My appetite was compromised. I was really eating when I was like feeling weak, because I didn't want to eat anything. So because of the nausea, and I knew that I had to somehow, I need to improve how I was eating, my doctor recommended a vitamin to improve the nausea. And that was the second time I vomited. The first time I tried the vitamin to help me to not feel nausea, I felt really sick and I threw up. Really weird. But some people have morning sickness all day during the whole first trimester, and in case that it's really intense, or in case it goes through the second trimester as well, which is week 14 and onwards, please talk to your doctor, because you can be experience something more serious like hyperemesis, and they can assist you, and it can be a risk factor for your pregnancy. The other thing that I experienced was tender breasts. Basically, it started before I found out that I was pregnant, but at that point I thought that my period was coming, and it was like those swelling, very tender and sore breasts. And then when I found out that I was pregnant, I was like, okay, this is going to stop soon because there's no period coming. But no, the whole first trimester I felt really sore. I couldn't sleep with my tummy down, and that's the way that I always prefer to sleep. Find some cotton or some soft material bra that will be comfortable to wear. Try to sleep on your sides or with your belly up whilst you don't have a big belly yet. The thing is, when we have the period, then usually it stops, but with pregnancy it continues, and it can continue all the way into breastfeeding. But for me, it was only the first trimester. As soon as second trimester started, it doesn't bother me anymore. Maybe I already got used to it. I don't know. The third thing I would like to say is the mood swing. They say this is the first trimester symptom that is very common, but honestly, this is a pregnancy symptom. It's something that a lot of my friends, even the calmest of friends that I have, said that they wanted to kill people at a certain point, you know, and a lot of crazy behaviors and things that are very funny sometimes, things that are very dramatic sometimes. So I don't think this is only a first trimester symptom, but definitely something that is stronger. You feel different from the very first trimester that you're pregnant. You feel much sensitive to everything, to things that are funny and to things that are not so funny, and to people that are around you may be annoying and irritating more than normal. So this is something that it can go through with you through the whole pregnancy. Like for me, I feel like I'm almost in the end of my second, starting my third trimester soon, but I feel like I am really sensitive to everything. Hopefully you will have some patient people around you to bear with the time until you are going back to normal again. Cramping is the fourth one I would like to talk about, because this one was one that I experienced, and sometimes I still experience even in my second trimester, and I didn't know there was a thing. I thought it was a menstrual symptom, and it's not. Apparently it's very common, because as your uterus is expanding, it's also cramping. I believe it was week 7. 6 or 7, I had a two week period in the very beginning that I experienced quite strong cramping, and I called my doctor because I was afraid of miscarriage. So when I started feeling cramping, I started to feel worried that because it was lasting 2 weeks pretty much every single day, that it may be my uterus expelling my baby. And I actually ended up not needing to go for an exam, because eventually it stopped. But as we talk on the phone, she explained that that's quite normal, but it can be painful. It can be as painful as the menstrual cramping that you feel when you have your periods. And sometimes it's just a discomfort, and that pass. And sometimes, and you don't need any medicine, but sometimes it can be quite strong, and maybe you need to take some paracetamol or take a warm bath, not hot, but warm bath, so you feel more calm to deal with the cramping. I must say that I was really lucky that I didn't feel anything else, but I noticed those 4 were the ones that I experienced, and pretty much every mom that I know also experienced in some level. But in saying that, there could be other things that you feel, like heartburn, a metallic taste, constipation is very common, food aversions and headaches, also very common. If you were feeling any of these symptoms that I'm going to state here during your first trimester especially, please visit your doctor or go to a nearest ER, because they can be cause of concern. So they would be heavy vaginal bleeding, severe abdominal pain, sudden thirst, painful urination, fever over 38 degrees Celsius with chills and or a backache, severe puffiness in the hands and face, vision disturbances. So if anything that you feel concerned, of course, don't wait for Google to tell you if it's normal or not. If you feel that you are concerned and that's causing you stress, especially with bleedings, go visit a doctor. Don't wait. Call your practitioner or your midwife to see if how you can manage this. So I will be talking to you soon about all the experiences of my first trimester, about exams that was recommended to me because I'm 36 years old. And I think this video was helpful, or if you want to share it with other people, other moms, please share, comment below your own experience and like it. Subscribe to the channel and visit the blog so you can hear more about how I'm experiencing my pregnancy, what I've been learning, and the full article about each video explaining in details everything that I'm talking quite quickly here in this video. Thank you so much. Ciao, ciao. Bye.